To all of you in the Department of Medicine, welcome back. 2020 was a really difficult year, but in the midst of this global health crisis, you've demonstrated immense dedication to your patients, colleagues, learners, and loved ones. The pandemic has hit us very hard. It's required redeployment to manage COVID activities, halted research, closed schools and daycares, and caused great tragedy in long-term care. We have not all felt the same pain to the same extent. We are in the same storm, but we sit in very different boats. Some of you have been able to pivot your scholarly focus to capitalize on COVID opportunities. Many of you have been deeply enmeshed in the COVID response and had to abandon virtually everything other than your clinical care and/or family responsibilities. Back in April, when I wrote in my chair's column that academic activities during a pandemic must take a backseat to clinical care, that was true then and it still is now. So please do not worry if COVID chaos has thrown your academic career track off. Just as we stop the 3-year probationary clock for myriad other personal situations, we will stop the clock for those of you who've been unable to perform expected activities due to COVID. But now, as vaccination has become real and COVID is in the rearview mirror, let's dig deep and find the fortitude that got us here in the first place. Let's look toward the light at the end of this tunnel. There is nothing we cannot accomplish if we put our minds together and work together. So while I ask you to continue to keep safe, healthy, and look out for others in less stable boats than yours, continue to bring the best to your patients and learners, I'd ask you to please also try to find joy in our contributions, in our efforts, in our unyielding desire to revolutionize healthcare. Happy New Year.